A history of depression does put a woman at higher risk than if she hasn't had a history, although no one is immune. Even women without any history can get hit hard with a postpartum depression. But certainly if she's had a personal history of depression, even a family history of depression, she should work proactively before she even gets pregnant and get a wonderful plan of action together with a healthcare practitioner who understands. If she's pregnant and she's feeling depressed, this can also put her at high risk. So if she's had depression during pregnancy, either previously or currently, she should definitely get help. If she's depressed in the second trimester, she is 3 times the risk of getting postpartum depression. And if she's depressed in her third trimester, she is 6 times the risk of getting postpartum depression. So the rule is, don't suffer, get the help you need, but certainly be proactive. If you know your history, get that plan of action in place so you won't have anything to worry about as you move towards having that baby. And ideally, your OB or your midwife or whoever you're working with should be screening you every trimester to make sure you're doing well emotionally.
I think people are surprised by how many things actually do put you at risk for postpartum depression. It's not 1 or 2, it's an entire laundry list. It's everything from if you've been through infertility treatment, those women are at a higher risk. Women who are immigrants, they're from a different area and they've moved and maybe they're not around the support system that they're used to. Women who are low income, lots of financial stress. Any woman who experienced any sort of trauma as a child, maybe losing a parent, losing a mom is a big one. Military moms whose spouses or partners are deployed. People who actually adopt children are at risk for having postpartum depression. If you have diabetes, type 1, type 2, or gestational, you're at a higher risk for postpartum depression. If you've had depression or anxiety or any kind of mental illness, it's a lot. It makes me sad that more women don't know about all of these and aren't warned in advance and sort of, prepared that maybe this might be something that would happen to them, because I think that would go a long way in helping moms understand what might come and that it's not their fault, that they had this real risk factor and that there's something that you can do about it. I look forward to the day when we do that a lot more.
Well, there are definitely risk factors that all women and their families should be aware of regarding postpartum depression. And before I list them, I should also note that having a pregnancy and birth for your first, second, or third child at any time, postpartum depression or depression or anxiety during pregnancy can present itself for the first time with, for example, the birth of a third child. And some of the risk factors include having a prior history of depression or a mood disorder, and also having a prior history of being a domestic violence victim, having had an abortion, having a loss, a miscarriage, stillbirth, having a family member who has a mental illness, having difficulty in general sleeping. So those women who are unable to sleep in general are at risk for having postpartum depression or related mood disorder. In addition, having lost a parent, especially your mother, early in childhood is another risk factor. And so it's important that families prepare, that they have discussions early so that they can form a game plan that accesses resources and support in their local communities.